Christy, thank you. Now it's time to talk health. We're joined by 7 News medical consultant Dr. Cedrek McFadden. We're going to talk today, Dr. C, about fatty liver disease, and we really want to understand what that is, because there is an alcoholic-related version, but there is another fatty liver disease as well, right?
Correct. So the non-alcoholic fatty liver disease is perhaps more common than you might think. 1 out of 4 Americans have it, and most don't even know they do. It's really caused by increased numbers amount of fat stored within the liver that over time could lead to liver dysfunction. It can lead to liver cancer, and in some cases there have been studies that show that if you have fatty liver disease, you have an increased risk of heart disease.
So what are the symptoms? How do you know you actually have this?
Well, unfortunately, most people don't have any symptoms, and when they do, it's generally fairly vague, like fatigue or nausea or maybe some abdominal discomfort. But most of the times, this is diagnosed when the doctor's looking for something else. Doctors don't routinely screen for it. They don't routinely test for it. It's seen when we are testing for other things, and that's why there's been a big push to understand more about this, to increase awareness and screening in people who are at risk. People who have diabetes, who are overweight, who have hypertension, who may be at increased risk for this and potentially long-term liver problems.
So what are the treatments when it comes to fatty liver disease?
Well, believe it or not, it comes back down to the good living, right? Even losing just 10% of your body weight can reduce the risk of this liver disease. And so consulting with a dietitian to make sure you're getting the food that you need. Now, this is not a liver disease that's caused by alcohol, but alcohol doesn't help. So if you have fatty liver disease, don't ignore it. Don't continue to drink alcohol, because it could be making it harder for your liver to heal and function properly.
And if you are worried about this disease, if you suspect maybe you should be tested or something should be done, what do you do?
Well, I think if you're in two of those categories that are more at risk, if you're overweight, if you have hypertension, those types of things, talk with your doctor, because this is not a test that you're just going to get a blood test for. There may be specific x-rays or ultrasounds or even biopsies that will give the diagnosis. But again, awareness is key to make sure you're not ignoring a potentially treatable illness and making it worse.
Dr. Cedrek McFadden, thank you. Now over to Diane.
Thanks, Amy. You do not want to be a victim of identity.